patient complains that it was asymptomatic, there was no symptom, but it suddenly changed his character. Pain may be the first indication of cancer. It's very important. The nodule was not painful, but it is now painful, and hoarseness. Hoarseness of the voice. Why? Because the cancer is growing and invade into the nerves. It changes the voice. It's very important indication for ultrasonography. There might be a history of low dose ionizing radiation. History of low dose ionizing radiation, and normally it is solid, fixed, hard, rapidly enlarging nodule in a patient under 14 years old or over 65 years old is suspicious for cancer. See, thyroid gland enlargement below 14 years and over 65 years is suspicious for cancer. Okay, now I'll go types. Number 1, papillary thyroid carcinoma. So it is the most common. %50 to 70%. Most common thyroid cancer. The most common thyroid cancer, 50% to 70%. And most often seen in patient age group 25 to 35 years, you can say young age group. The least aggressive. Least aggressive, that means it remain like a dormant, remain like a thyroid benign nodule, but do the biopsy, it came up papillary type of thyroid carcinoma. can become invasive. Can become invasive in child younger than 7 years and adult older than 50 years. Okay, this is papillary types. The treatment usually given: partial lobectomy, radical neck dissection, and suppressive therapy may follow after removal. So partial lobectomy, the treatment. Partial lobectomy, then radical neck dissection, and suppressive therapy. May follow removal. Okay, they might give the suppressive therapy, then they do the removal of the gland. Okay, so that is papillary. Now the other two I'm giving. Follicular. Follicular type. It is the next most common after papillary. Peak age is peak incidence is 40 to 50. Most aggressive. And another type is medullary. This is most lethal. Most lethal of the three listed here. Mortality rate approximately 40% within 5 years of diagnosis. Okay, within 5 years of diagnosis, mortality rate 40. But nowadays there's a lot of facilities are there so that they can diagnose earlier than that. Okay, so with this I will conclude the thyroid lecture, and there will be a parathyroid lecture. It will be maybe not more than half an hour. So the thyroid gland that we understood everything, and finally we figure it out. The thyroid gland, which is a very small endocrine gland, and it has so many diseases, yes, and it can change a lot of situation in the body. It can influence the people's behavior, people's psychological and personal disorders can be influenced by this type of gland, by its overfunction and hypofunctions. And there are definite specific indications for doing the ultrasonography of the thyroid gland. Not only because of the signs, symptoms, it is also due to the cosmetic disorder, because it is in the neck. And if you want to expose your neck because of this gland pathology, gland's disorder, you cannot expose your neck because it shows maybe the way you don't like it, or somebody may not like it. So that's why advice is, if you see whenever you have a voice change without any cold or flu or any other things, you must notice it. If you feel pain in the neck, and if you feel some mass, you felt it before, it was painless, now it is painful. And you feel like my mind is swinging and my mood is changing and I cannot control my temper, so then you have to go to the doctor for evaluation. And one more thing, while you are trying to do the protocol of the thyroid gland, you must take the history from the patient. Did he or she ever get any radiation close to the neck? And the occupation, what type of job he or she is doing. Okay, so this is a small gland, endocrine gland, but it has a lot of pathology that can change your lifestyle too. And keep that in mind. Among the endocrine glands, thyroid gland is the first endocrine gland that produce, because our body needs thyroxine. And the thyroxine, one of the major function is it maintains the growth and development, and it balances the basal metabolic rate. Every cell has their own functions, and some cells are more responsible for metabolic functions. And you know the metabolic functions of a cell means it produces the energy, it produces the water, and it produces the carbon dioxide. So it balances, it maintains the basal metabolic rate of the cells, means our whole body. Okay, I hope you will like this lecture, and it will help you in a lot, because in the exam, because there are a lot of patients. If you work in an endocrinologist department, you will see a lot of patients are coming with the thyroid gland disorder. Okay, thank you very much for your paying attention. Thanks.